with the gut microbiome, I see there's so many nuances to it. When someone does come to the door, how do you know, and they just say, I have these symptoms, I have bloating, blood in the bowel. What is the step-by-step we take to properly diagnose them? Because as you said, not having enough pancreatic digestive enzymes, that's a rarity.
Yes.
So being able to funnel options of possible diagnoses all the way to that one,
Yeah.
what does that process look like?
Yeah, so it involves a series of tests. I think it would be just to backtrack a little bit. I think it's really nice to come and see an expert. We have spent countless um, hours, studying these algorithms, looking at the data, and designing algorithms for patients just like this, so that every test that we do has a purpose. We're excluding something. So let's take one condition, for example, someone who comes in with symptoms of irritable bowel syndrome, but the diarrhea variant, and they're presenting to me. So what does that look like? Well, I will be doing some stool testing to make sure that, they don't have a chronic infection. I'll be doing some blood tests to make sure that they don't have celiac disease. If they're having any symptoms that are concerning to me, like you mentioned, blood in the stools, that always raises off alarm bells in any GI's approach. And so that would warrant actual procedures to go inside and see, well, why are they having blood in the stools? Sometimes I need to do imaging of the small bowel, which I can't easily access with my scopes. But if after that exhaustive workup I am not finding a solution, then I would maybe make a diagnosis of irritable bowel syndrome, diarrhea variant, and focus my management on symptom management. And it doesn't end there. Even in terms of symptom management, there I could make a case for giving patients probiotics. I could test them for bacterial overgrowth, so put them, do further testing. But everything is being done in a methodical way. It can sometimes be frustrating for patients. We're so used to getting these quick fixes and quick answers, and sometimes, we need to rule out the scary stuff and then proceed in an algorithmic manner, so that we know that, okay, we've tried this therapy, this didn't work, because patients are also, they respond to different things differently. I may have a patient who responds wonderfully to a dietary intervention. You mentioned the low FODMAP diet. While I may have a different patient who would simply just want antidiarrheals because they don't want to be on the road during carpool, with a need to rush to the bathroom. So don't discount what your GI or your provider can offer. It's important to be in tune with your body, but the reason we go through a gamut of tests is because we're trying to rule out certain things and just direct our management.
Makes perfect sense.